Internal devices are just what they sound like. They are inserted into the vaginal canal and they help to support the inside of the vaginal canal to help hold those organs in place. The first type of internal device, internal supportive device that we're going to talk about are called pessaries. All right, so here's an example of a pessary. Here's another example. They come in so many different shapes and sizes. They're usually made of medical grade silicone that's able to be placed inside your body. Pessaries are specifically designed to help with pelvic organ prolapse, and they need to be prescribed by a healthcare provider and fitted by a healthcare provider. In the US, that's usually an OBGYN or a urogynecologist. Globally, I know that there are quite a few pelvic health physical therapists that are trained in this, and they can help fit you and size you and monitor pessary use. The healthcare provider will recommend the best shape and size depending on the type and severity of your prolapse. For example, someone with a mild anterior vaginal wall prolapse, remember, so that's where the bladder is starting to collapse into the vaginal wall. They might get enough support with a ring pessary, like this, a ring pessary. Someone with an advanced uterine prolapse might get more support and results with a cube. I've listed here 3 different types of pessaries: the gel horn, the ring, and the donut. And you can see that they go inside the vaginal canal there to position and support and lift those organs. Like we said before, there's many different shapes, there's many different sizes, and so finding an experienced provider that can work with you to help fit you for the best type of pessary is an ideal scenario. As you can see in this image, this one type of pessary has multiple sizes, right? We go from small to large. So a small pessary might fall out. It might not provide the support that you need. Or a large pessary might be too much. It might be uncomfortable. So finding a provider that can help figure that out with you is really important, and it might take trial and error to figure out what works best for you. When you're in your pessary fitting appointment, I really recommend that you simulate doing some of the activities that you want to do with the pessary in that appointment. So great if the pessary is staying in and it feels good when you're standing, but if your goal is to do box jumps, well, you might even take a little box with you to the appointment and simulate doing some of that and see how it feels with that pessary, because you're really not going to know how your body is responding to that device and how it's working with you unless you simulate and practice the functional activity that you're trying to achieve. In the past, pessaries have been considered to be only for like very senior, frail little ladies that had pelvic organ prolapse that weren't eligible for surgery. And what typically would happen is that providers would insert the pessary and then leave it there for weeks and months. And so they would go back at whatever time interval that provider said, but let's say it's a 3-month time interval to have the pessary removed and cleaned and then reinserted. There are some providers out there that still have that concept that pessaries are only for older people or for people that are ineligible for surgery. However, I want to help dispel that myth. It's a myth. Pessaries can be very effective at helping to manage pelvic organ prolapse regardless of your age. It's important that you know how to insert and remove your pessary if you're not wanting it to be left in there 24/7, which most active people don't want. And so with that pessary, you can choose when you want to wear it. Do you want to wear it all day long? Is that the support that you need? If that's the support you need, fine. If you only want to wear it during strenuous activities, like during weightlifting or during running, that's fine too. But having the knowledge and the tools to be able to insert and remove it safely is very important. Some pessaries can even be worn during sex, though most of the people that I've worked with have wanted to remove their pessary during penetrative vaginal intercourse. But again, that option is out there. If you are someone that may have severe arthritis or may have some mobility impairment or some other reason why you're not able to independently manage your pessary, that's okay too. The healthcare provider that helps to fit you for your pessary can also help you manage your pessary. So you'll want to make regular appointments at whatever interval your provider recommends so that you can go in there, have your pessary removed and cleaned. They'll also want to check your skin and make sure that everything looks healthy, and then they can reinsert it. The big takeaway from this slide here is that there isn't one option that works for everyone. Some people may just need to use a pessary when they're on a jog twice a week. Some people may want to use it every afternoon after they've been up on their feet all day. Some people may want to use it all day long, every day, and some people may want to use it 24/7. There are plenty of options out there, and there isn't one right option or right choice that works for everyone. So really figuring out what works for you is the most important thing. There is guidance out there that says when possible, people should learn how to insert, remove, and clean their pessary independently. Like we discussed earlier, there are people that may have mobility impairments, may not be able for whatever reason to manage the pessary independently at home, and that's okay. So just making sure that you have a plan with your healthcare provider and that you keep your regular follow-up appointments to help manage that pessary safely and hygienically. Common side effects of pessaries include unusual discharge and odor. And so those are two really important elements that you'll want to monitor. In some cases, pessaries can even irritate the inside wall of the vaginal canal. And so it will be really important for you to follow up regularly with your healthcare provider if you're using a pessary. Also, listen to your body. So if inserting the pessary didn't used to be uncomfortable, but now it feels really irritated and painful, then that's a warning sign that your body is saying, hey, maybe this isn't the best choice right now. And that's when you'd want to make sure that you follow up. Serious complications from pessaries are rare, and most of these would occur with long-term, like 24/7 use. If you're just inserting the pessary for short periods, or you're inserting it at the beginning of the day and then removing it at the end of the day, I wouldn't expect, and I haven't heard about these side effects with using a pessary that way. But that being said, still be aware.